for younger patients who relapse, first thing you have to decide is, could they be suitable for a second autologous transplant? So in the past, if they did not relapse, if they had not relapsed for at least 18 months post-transplant, you might consider a second transplant. And nowadays, because people are on lenalidomide maintenance, you might, the patient would really have to be about 36 months before relapse, before you could consider a second transplant. For other younger patients who relapse, basically, again, you would be trying to use triplet therapy using a combination of a proteasome inhibitor and or an IMiD and or cyclophosphamide and or a monoclonal antibody. And basically, for first relapse, you're basically trying to use combinations that they haven't had, and also deciding if they are sensitive or refractory to previous therapies. So that can be tricky because of the number of therapies we have available in these different categories. But we tend to use the ESMO guidelines to help us with this.